Hello, and welcome to Microbiology Bites. Humans are host to over 300 species of parasitic worms and 70 species of protozoa, some derived from our primate ancestors and some from the animals we've domesticated or come into contact with during our history. The best documented parasitic disease known from ancient times is caused by the nematode worm Dracunculus medinensis. The earliest description is from an Egyptian papyrus from 1500 BC that refers to both the nature of the infection and to techniques for removing the worm. Confirmation of the presence of this worm in ancient Egypt comes from the finding of well-preserved worms in Egyptian mummies. Dracunculiasis, or guinea worm disease, is one of the few diseases unambiguously described in the Bible, and most parasitologists accept that the fiery serpents which struck down the Israelites in the region of the Red Sea after the exodus from Egypt were actually guinea worms. The adult worms live in the subcutaneous connective tissues of their victims, from where the females emerge to release thousands of larvae into the water, where they're taken up by intermediate hosts, which are tiny aquatic crustaceans called cyclops. In these hosts they mature into infectious larvae that infect humans when the crustaceans are accidentally swallowed in contaminated drinking water. On maturity, the large female worm, which can be nearly up to a metre in length, protrudes from the skin, usually of the leg, and causes intense inflammation and irritation. The effects of the disease are crippling. Its victims develop large ulcers, usually in the lower leg. The ulcers swell, sometimes to the size of a tennis ball, and burst, releasing the spaghetti-like parasitic worm.
Soil-transmitted helminths cause chronic infections in over 2 billion people living in developing countries. Chronic helminth infection is particularly problematic for children and can lead to poor growth, mental impairment, and increased susceptibility to other infectious agents such as HIV, malaria, and tuberculosis. Hookworm, which is illustrated here, also causes anemia by feasting on host red blood cells. Vaccine design has unfortunately been limited by our poor understanding of host immunity. However, we have recently shown that antibodies can kill intestinal helminths. We now hope to define exactly how antibodies function. Do they attack the parasite directly? Or do they first need to bind to and activate white blood cells such as eosinophils? Such information is imperative to the end goal of designing novel and effective vaccines against these parasites.